Have you ever caught yourself wondering, could something you do every day, something you think is completely harmless, actually be quietly affecting your prostate? Maybe it's a habit you never even talk about, something so private you don't even bring it up with your doctor or even your closest friends. And yet, it could be shaping the health of your body in ways you never imagined. Picture this. You've been living your life thinking everything's normal. You feel fine, maybe even healthy. But deep down, there's this tiny worry, a little nagging question in the back of your mind. Am I really doing what's best for my body as I get older? That question matters more than you realize. Because prostate health, it's not just about a number on a chart or a quick medical check. It's about your daily life, your energy, your confidence, even your relationships. It's about keeping control over your body as you age, and protecting your comfort and dignity in the years to come. And here's the thing, Harvard researchers actually studied this. They looked at habits many men think are private or even shameful. And what they discovered? Well, it might shock you. By the end of this video, you're going to know exactly what their research says about daily masturbation, how it truly affects your prostate, and the simple, practical steps you can take to protect yourself. Steps that can change the way you feel every single day. So, if you're ready to cut through the myths, if you want real research-backed answers about something almost no one talks about, comment, "I want to know" right now. And make sure you subscribe to Elderly Advice for Life, because we're going to explore health tips that actually matter, tips that help you stay strong, confident, and informed as you age. Stick around because what you're about to hear could change the way you think about your health forever. Now, let's take a closer look at what the research actually uncovered. Imagine a group of men over 50, each living their own life, going about their routines. Some exercised, some didn't. Some ate well, some struggled with their diet. But researchers didn't stop at the usual questions about lifestyle. They asked about habits most men consider private, habits rarely talked about even with doctors or partners. They followed these men for years, tracking not just general health, but specific outcomes linked to the prostate. And here's what they found. Men who ejaculated more frequently, whether through sex or masturbation, actually had a lower risk of developing aggressive prostate cancer. The link was clear enough to make scientists sit up and take notice. This wasn't some small anecdotal finding. Over time, regular ejaculation appeared to help the prostate stay healthier, possibly by clearing out harmful substances and reducing inflammation. Now, I know what some of you are thinking. Wait, masturbation? Doesn't that weaken a man? Isn't it bad for your health? That's a misconception that's been floating around for decades. The truth, backed by research, is quite different. For prostate cancer risk, this private habit seems to have a protective effect, not a harmful one. It's one of those surprising things where what people have been taught for years doesn't quite match what the data says. Of course, this doesn't mean you should overdo it or stress about hitting some magical number every week. Moderation is key. Understanding how your daily habits affect long-term prostate health allows you to make informed choices, rather than letting myths and embarrassment guide your decisions. But here's the thing, frequency alone isn't the whole picture. Your age, lifestyle, diet, stress levels, and other habits all combine to influence prostate health. So while regular ejaculation can be protective, it's only one piece of a bigger puzzle. And that brings us to the next crucial insight, how frequency really ties in with overall health outcomes, and why it matters more than you might think. Let's talk about frequency. How often is actually helpful, and when could it go too far? Think about John, a 60-year-old man, living a pretty ordinary life. He wasn't someone who obsessed over every habit, but he did have a routine he followed. At first, he wondered if he was overdoing it. Maybe he felt a little guilty about it or worried it could be harming him. But here's the reassuring part. His annual checkups consistently showed excellent prostate health. No problems, no signs of inflammation, just solid results year after year. Harvard's research gives us some insight into why. They found that men in their 40s who reported about 21 or more ejaculations per month had a noticeably lower risk of developing aggressive prostate cancer later on. That's roughly once every day or so. Men who had fewer ejaculations didn't enjoy the same level of protection. It seems that regular activity, rather than sporadic or rare activity, is what contributes to a healthier prostate over time. Now, I want to pause here and address a common misconception. Some people think, the more, the better, and that piling on frequency will supercharge your protection. That's not exactly true. Excessive habits can sometimes lead to irritation, fatigue, or even emotional stress. The body works best with balance and the mind needs peace of mind too. So what does this mean for you? It means finding a rhythm that feels natural for your body. Daily activity isn't harmful. It can be part of a healthy routine. But forcing it, stressing over it, or letting it become compulsive isn't necessary, and it doesn't provide extra benefits. Think of it like exercise for your prostate. Consistency matters more than intensity. But here's the key point I want you to hold on to. Frequency alone isn't the full picture. Your overall lifestyle, your diet, your activity level, stress, sleep, and even emotional well-being plays a huge role in prostate health. And that's where the next insight comes in. Understanding how these lifestyle factors can amplify or diminish the protective effects of your daily habits. Now let's zoom out and look at the bigger picture. Think about Mark, a retiree in his mid-60s. He didn't just focus on one habit. He combined regular exercise with a healthy, balanced diet, plenty of water, and good sleep routines. Over the years, his prostate markers stayed healthy. No surprises at his checkups, no major concerns. That didn't happen by accident. It was the combination of multiple, simple lifestyle choices that gave him that advantage. Science backs this up. While regular ejaculation has been shown to reduce certain risks, it isn't a magic bullet on its own. Diet, exercise, sleep quality, and hydration all interact with prostate health in meaningful ways. Think of it like building a safety net. One strand alone helps, but the more strong strands you weave together, the safer and more protected you are. There's also a misconception I want to clear up. Some men think, well, if I keep up regular habits in the bedroom, I don't need to worry about what I eat or how active I am. That's misleading and potentially dangerous. A prostate-friendly lifestyle means paying attention to multiple factors at once, not relying solely on one behavior. So what can you do? Start by incorporating prostate-friendly foods, tomatoes, green vegetables, fatty fish rich in omega-3s. Keep moving even if it's just a brisk walk every day. Make sure you're hydrated and try to get consistent, quality sleep. These aren't extreme changes, they're simple, realistic steps that, when combined with regular ejaculation, give your prostate the best chance to stay healthy as you age. But here's an important point to remember. Even if you're doing all the right things, there can still be subtle warning signs your body gives you. Small changes you might brush off, maybe a little discomfort, a slight change in urination, or a shift in sexual function, can be early signals that deserve attention. And that brings us to the next critical section. What those warning signs are and why recognizing them early can make all the difference. Now let's talk about something that many men and even their families often overlook. The subtle warning signs your body gives you. Take Alex for example. He was in his early 60s, active and generally healthy. But he started noticing a few little things. Frequent trips to the bathroom, a slight discomfort when urinating, maybe even a little fatigue he couldn't explain. At first he brushed it off thinking, well, I'm getting older. This is just part of aging. But here's the problem. It wasn't just aging. Those small, easily ignored symptoms were early signals of prostate issues. And this is where science really matters. Symptoms like difficulty urinating, changes in urinary flow, persistent discomfort, pain, or sudden shifts in sexual function can all point to underlying prostate problems. Some of these could develop into serious conditions if left unaddressed, while others can be managed or treated much more effectively when caught early. A common misconception is that any discomfort or minor change is just a normal part of getting older. But the truth is, while some changes are natural, many are not, and assuming they're harmless can delay treatment and make problems worse. This is why paying attention to what your body is telling you is so important. So what can you do? First, don't ignore even minor changes. Schedule regular checkups, and if you notice anything unusual, discuss it with your healthcare provider promptly. Early detection is your strongest ally. It can make the difference between a minor issue that's easy to manage and a serious problem that's much harder to treat. Recognizing these signs early can truly be life-changing. It's not about fear, it's about awareness, responsibility, and taking control of your health before small signals turn into major concerns. And once you understand this, you can approach your prostate health with confidence, knowing you're listening to your body and acting proactively. Now, let's dive into an aspect of prostate health that doesn't get nearly enough attention: the emotional and psychological side. You see, many men avoid talking about this topic, sometimes out of embarrassment, sometimes because they think it's just a private matter. And that silence, that reluctance to open up, can have real consequences. Anxiety builds up, stress increases, and small health issues can go unnoticed for far too long. Think about it: your prostate isn't just a small organ tucked away inside your body. It affects sexual function, urinary comfort, and even how you feel about yourself. When problems arise and are ignored, it can impact intimacy, confidence, and your overall emotional well-being. Science tells us that stress, shame, and misinformation don't just affect your mind, they affect your body too. Chronic stress can worsen inflammation, disrupt sleep, and make recovery harder if any medical issues appear. There's a common misconception that mental health and emotional factors aren't part of prostate care. Many men think, if I just keep my body healthy, everything else will be fine. But ignoring your emotions, communication, and mental health can actually make outcomes worse. It's all connected: the mind, the body, and how you handle your habits and symptoms. So what's the practical step here? Start talking. Talk openly with your partner, a trusted friend, or your healthcare provider. Ask questions, share concerns, and don't let embarrassment stop you. Educate yourself with credible research like Harvard studies so you can separate myths from facts. When you combine awareness of your habits, lifestyle, and emotional well-being, you give yourself the strongest chance at maintaining prostate health and peace of mind as you age. Understanding all these angles, physical, emotional, lifestyle, is vital. Because once you see the bigger picture, you start realizing that prostate health isn't just a medical issue. It's a part of your overall quality of life, your confidence, and the way you experience your daily life. And now, having explored all these factors, it's time to reflect on the emotional impact this knowledge can have, and how you can turn it into proactive care. Now, let's pause for a moment and think about the emotional side of all this. Watching someone you care about, maybe a partner, a friend, or even yourself, struggle with prostate issues or sexual health can be really hard. It can feel frustrating, confusing, or even a little scary. But here's the truth you need to hold on to: knowledge is power. The more you understand what's happening, the earlier you can act. Early awareness doesn't just prevent serious problems, it protects dignity, comfort, and the simple peace of mind that comes from knowing you're doing what's best for your health. And here's an important shift in perspective I want you to make. Instead of letting fear or embarrassment guide your decisions, you can turn this knowledge into preparedness. Instead of worrying silently about aging or your habits, take proactive steps. Understand your body, track changes, and act before small issues become bigger ones. It's not about living in fear, it's about living with control, confidence, and care. So what can you do right now? Take a few minutes today to reflect on your habits. Think about your lifestyle, your diet, your exercise, your stress levels, and yes, even your private habits. Schedule your next checkup if it's been a while. And share this information with someone you trust. It could make a real difference not just for you but for someone else who might be silently worrying just like you once were. Finally, remember this: it's never too late to start making positive changes. Small, consistent habits, whether it's improving your diet, staying active, managing stress, or understanding your sexual health, can have a huge impact over time. Awareness, care, and tiny daily choices can safeguard your prostate, your well-being, and your peace of mind. And knowing this, you can move forward with hope, confidence, and a renewed sense of control over your health. So, before we wrap up, let's take a moment to go over everything we've covered today. To recap, Harvard's research shows that regular ejaculation can help lower the risk of prostate cancer. Frequency matters, but balance is key. Overdoing it isn't necessary, and underdoing it might not give the same protection. Lifestyle factors, like diet, exercise, hydration, and sleep, can amplify the benefits of these habits. And remember, early warning signs, even subtle ones like changes in urination or discomfort, should never be ignored. Lastly, mental and emotional well-being plays a huge role in prostate health, so don't underestimate the power of talking openly, reducing stress, and educating yourself with credible information. Now, I want to hear from you. Have you noticed any of these warning signs in yourself or someone you care about? Maybe you've seen small changes you weren't sure about, or maybe you've been proactive with checkups and habits. Comment below. I'd love to hear your experiences and thoughts, because sharing can help others feel less alone and more informed. And if you found this video helpful, consider subscribing to Elderly Advice for Life. This channel is all about giving you practical, research-backed health insights and tips that truly make a difference in your daily life. Hitting that subscribe button ensures you'll never miss another video that could help you or someone you care about live healthier, longer, and with more confidence. Finally, thank you for taking the time to watch and learn today. Stay informed, stay proactive, and remember this: small, consistent daily choices, simple things like your habits, diet, and awareness, can have a huge impact on your long-term health. You have the power to make a difference in your life and in the lives of those you love. Keep moving forward, take care of your body, honor your health, and I'll see you in the next video.